Okay.
All right, looks like we're recording. So, and I forgot to arrange to get a bio from Lisa Ashley, so I'm just going to have to wing the introduction. But I've known Lisa for a day or two, so I think I can probably wing it. Lisa's had a great career in the palliative health career field, working many years for hospice in our region, and now is at Bay Bluffs facility in Harbor Springs. And how long have you been there, Lisa, now?
6.5 years.
6.5 years. So it's a
Yep.
great tenure. Certainly a challenging job, as she will tell you, and more challenging in this past year. And otherwise, Lisa, great mom, great family person, great community member, and great contributor to our schools and other programs in the community. So delighted to have Lisa Ashley with us this morning. Good morning, Lisa.
Good morning, Carlin. And I know you have to leave. I just want to say thanks really a lot for putting me after the Baseball Hall of Fame. I'm pretty sure I've been there and it was awesome. There's no way I can top that presentation. So thanks a lot, friend.
My pleasure.
Fun fact, I was part of the Noon Rotary Club. I'm used to seeing Steve Schumann at the back table. So it's odd to see him on my computer screen. Good morning, Steve. I was the club secretary, took that role on after Russ Langs. Many of you may know, amazing Rotarian in our community for a number of years. My husband is a Paul Harris Fellow. I think we were the first married couple in Rotary Club Noon Petoskey before there was Sunrise Rotary. So four-way test, not only is it a great thing to say every day and to teach your kids, but it's kind of like riding a bike. You don't forget it. It sticks with you after every Wednesday lunch. So anyway, I will get into my my spiel. We were talking a little bit before folks joined about kind of how crazy this last year has been. Carlin asked me to do a presentation, and I'm not really sure how much folks know about Bay Bluffs. So I wanted to give folks a couple second overview of exactly who we are, and then just give you the snippets of what we have been through over the last year, just so that you have a different perspective maybe on what's been happening. So let me see if I can get my screen to forward. And now it's not going to share. Can everybody see my screen? All right, so we are a county medical care facility with our roots in Public Act 280 from 1939, which created county poor farms. Fun fact there. We consider ourselves a safety net service, so we care for the most frail and vulnerable medically and financially in our community. We employ BC, I say before COVID, we were up to 200 plus employees. Right now we have about 157 employees at Bay Bluffs. About 85% of our residents have dementia, which makes it challenging. Before COVID, we had an occupancy rate of about 94%. 94% of our 120 beds were full at any given day. Now we are about 61%. Which is about the national average currently post or in the midst of COVID. We are one of 36 county owned facilities in the state of Michigan. We are one of 10 county facilities that does not have an operating millage. So your tax dollars do not go to operate this facility. We operate entirely on the revenues we achieve through Medicaid, Medicare, and private insurance, and just a handful of folks that are here on private pay. And we are the second highest regulated industry in the country. Next to nuclear power is the first highest regulated industry, and nursing homes are the second highest regulated industry. We're licensed by the state of Michigan. We are certified by the Centers for Medicare and Medicaid Services. We operate under those regulations. In the last 400 days, we've had over 500 regulatory changes just specific to nursing homes alone, and that is specific to COVID alone. And our roots since 1966, when the community built this facility, continue to be caring for the most frail medically and financially in our community. Just so that folks are aware of the county's investment in this facility. In the 60s, there was the original millage to build the building. There was a large capital millage that occurred in 2001 to add some additional square footage and additional beds to the building. That was about an $8 million campaign. And in 2018, we requested some county support for some updates to the facility. Other than that, as I mentioned, we operate entirely on our own. The county does own the building. The Department of Health and Human Services Board of Directors operates the facility, and that's who I work for and who our staff work for, is the DHHS board. Just a little schematic there of our facility, since, you know, I would love to have you in the building at some point, but that's just not possible, probably not for quite a long time. We have 120 beds. As I said, we have 16 private rooms. That's it, 16. The rest of our rooms are double occupancy, a semi-private that has a wall between the two beds, and then a double occupancy room that is more like a hospital room. And these are actually nice rooms in consideration of many other nursing homes around the area. And for those that may not be aware, there is a significant difference between nursing home and assisted living. Nursing homes are really the highest level of care possible outside a hospital. So we have folks that come to us from hospital setting requiring significant wound care management, infection control management, and many other medical conditions. Oftentimes, again, because most of our resident population has dementia, they need to live here for their own safety and well-being. And most of our folks are on Medicaid, which means they have no financial means to either have care come into the home or care be provided in an assisted living setting, which right now in the state of Michigan, assisted living settings are private pay only. Again, just some fun facts about us. Our average age of our resident population is 85. We care for a significantly older population than most other nursing homes, frankly. Again, 75% of our folks are on Medicaid. 90% of our population hails from Emmett County. The other 10% are from other counties that do not have a county medical care facility, like Otsego, Presque and Sheboygan counties. About 10% of our daily census are on short-term rehab, which means they live here for about 21 days or less. We get them perked up and rehabbed and back to home, which is always our goal, is to have people living at their highest quality of life possible. Before COVID, we've been working on a capital plan since 2015, knowing that our facility was aging and that the resident population was changing dramatically. You know, when I got here 6.5 years ago, we had quite a few folks living here with dementia. That has significantly increased. Folks that used to live in nursing homes 15 to 20 years ago now live in assisted living. Folks that probably could and would and have been cared for in a hospital setting are now living in nursing homes. So we knew that our footprint, our physical layout, everything that we have physically in this building has needed to change to accommodate that census that is more increasingly folks with dementia. And so we've been working on that plan with the county since 2015. Definitely had some publicity over the years about that and those conversations. I think we're closer in 2021 to having some positive interaction come forward about capital and our capital needs than we've been in the last 6 years. We did in 2020, with the county's challenges with their own budget, relaunch our foundation. It's a separate 501c3 organization with a separate board of directors that had been started back in the early 2000s to kind of help with some scholarships for staff and some other things. We regrouped with the help of some community philanthropists that are probably familiar to many folks. And our foundation is now up and running and has been raising funds through memorial gifts and grants through the pandemic, which has been extremely helpful to our staff. Obviously, life with COVID, we have had per mandates from the state and the federal government, restriction on visitation since March 11th of 2020. So nobody really wants to move into a nursing home when you drop your loved one off and you can't see them again. So obviously our occupancy has decreased. We knew 30 years ago we were going to have a nursing shortage. That was not unknown to us. And the pandemic has caused many nurses to retire sooner than expected. It is creating a bigger challenge and more competition among all of us in healthcare for nurses, LPNs, RNs, and nurse aides. And right now we have had more referrals we've had to turn away because we couldn't safely staff and care for their needs. And that's a problem for our community. It is a problem for our elders, and it's a problem for us as a business moving into the future. And I try to remind folks we are in the worst healthcare crisis in 100 years. That cannot be taken lightly. This is nothing that any of us in healthcare have ever had to deal with before. And we're trying to make our way through that the best way possible. So as Carlin mentioned in my introduction, I've worked in hospice and palliative care for 20 years. This year has been the worst year of my career, even in all the times that I've had to be with people at the end of their lives. This has been the toughest for us and for me personally. Very, very, very proud of my team. It is thanks to their efforts and their prevention efforts that we've had one resident who's been COVID positive this last year. I'm sure you've seen many of the other state and national and even local news where there are nursing homes who've had 100% of their occupancy, their resident population have COVID, be infected with COVID, and 25% of their census die. We've had one resident who was asymptomatic positive for COVID throughout this whole thing. So I'm bragging for a second because I'm very proud of that. We've had about 20 staff positives in the last 14 months. We have spent more than $100,000 on personal protective equipment. We've worked with many local organizations and businesses to help supplement that with some donations. Petoskey Plastics being one of them, who stepped up early for those of us in the community taking care of people and trying to keep them safe. So shout out to Petoskey Plastics for that help. And as I mentioned, more than 500 regulatory changes just for long-term care alone. That means we've had to basically pivot almost every day, at least once a day, related to infection control measures, related to the use of PPE, related to testing. My staff have been tested now every week since the end of June, sometimes twice a week. I've become a lab tech, didn't know I was ever gonna need to be a lab tech for any reason, but with COVID testing comes COVID test processing, and we have to do that all in-house. So we've been testing now for about 42 weeks. And again, only one resident positive. That is a testament to the fact that our staff have made a lot of sacrifices in the last year, not seeing their family members, not being a part of community. For Mr. Parker's sake, in case you ever want to see them again, Chris, I've saved every email that you've sent at 5:55 every day as part of our community activities and connection. And our staff have kids in the school systems, and they've been able to keep themselves safe along with our residents being safe. So again, we're pretty proud of that effort. After COVID, which we have no idea what after COVID means or when that will be, but we expect there will continue to be a growing need for our elder care services. Obviously, there will be a significant investigation into whether congregate living or nursing home care is necessary for as many people as we had predicted, but it will be necessary for quite a few, especially because medical conditions continue to be more acute and require more intensive care. Again, the big question for us is who's going to provide that care. We have relationships with North Central, with Lake Superior State, and with several other colleges in the region, but they can't produce enough nurses in enough time to help support us and the rest of the healthcare industry. We also compete with the hospitality industry for our support staff, our housekeeping staff, our dining staff, our cooks, our chefs. So as a community, we have a lot of regrowth and rebuilding to do as we move through COVID. What's next specifically for us as a county asset? This facility was created by county residents to provide for county resident needs. We have significant capital that we're going to need in the near future to replace aging boilers, to replace things that we now have a reduced capital in the bank to be able to address because of all of the efforts we've made to protect ourselves through the pandemic. So we will be coming back to the community with some plans for that. But again, as the baby boomer generation ages, it's important for us to have these safety net services with, again, our focus primarily on those that are the most medically frail and financially vulnerable. So that's who we are. We're your service. We're probably the only healthcare service around that you have an impact on with your votes and your support. So just to make sure that as Emmett County residents that you're aware, we are here for you and we are here because of you. And we will hopefully continue to be for another 55 plus years. So that's me. That's us.
Can I ask a question?
Absolutely.
Lisa, yeah, what's the story with veterans as far as any kind of VA or people that have veterans? You talk about Medicare, things like that. What about people that have veteran status?
That's a great question. So the VA has a pretty rigorous application process to become a provider in a region. Right now, I believe they have not rebid that. So currently the VA benefit is applicable at the Villa in Petoskey. Once that is an opportunity for us to reapply, rebid per se, to be a part of that program, we would absolutely do that. We have worked with individual veterans on occasion, but if, for example, you are fully covered under the VA benefit, they prefer that you reside at the Villa at this time.
Lisa, what do you say to employees who refuse to get vaccinated?
That is a great question. That is something we have been trying to address every single day. Right now, because our resident population ebbs and flows and changes, we've got about 90% of our residents in-house who have accepted the vaccine and are fully vaccinated. We're still working with the families of other residents to try to help educate them to make that choice for their loved one. We are at about 55% vaccination rate for our staff, which is actually really quite high in the state of Michigan for nursing home staff. So we're proud of that effort, but it is literally a day-to-day, one-to-one conversation. There's been a year full of misinformation, lack of information, information that has not necessarily been fully accurate about vaccination and COVID in general. And so it's going to take us some time to combat that. Our medical director is Paul Blanchard, and he has provided our staff with a lot of one-on-one question and answers. And at this point, that's what we're doing, is trying to address their fears and their concerns, address the science and the research behind the vaccines to try to help folks be more willing to accept that. Right now, the vaccine protects you from more severe illness. And there are two studies that were recently released, one from Kentucky and one from Illinois, where vaccinated residents in nursing homes did have COVID, but there were no hospitalizations and no deaths related to those. To us, that is our best protection for our resident population right now. We don't want to be that statistic that has 100% infection rate and 25% death rate. So
Thanks.
You're welcome.
Thank you. Just want to say thank you for the work that you've done and your team has done. Our motto over here at the school, is every opportunity to make a positive difference in the life of a kid. and really being that voice for kids who don't have a voice otherwise. And I just, one positive case, so excellent medical care, excellent, prevention strategies, and then keeping his staff to take really good care of people who otherwise might not have an option, I think is just outstanding. So thank you.
Thank you very much. And again, back to you, Chris. I do have every single email you've sent us, but the work that the school has done to protect kids, keep them in school. I think our students are the best followers of mask use. And I can't stress enough how what we do as citizens outside in the community comes back into places like mine. And you don't even realize the connection that you have. You are connected. Every single one of you are connected to this place in some way. And you make a huge difference in our ability to keep our elders safe. And we are doing visitation, by the way. The families that have been able to reconnect, again, this has been one of the hardest years outside of my hospice career. This has been one of the hardest years in healthcare, and to have families reconnect finally after a year has just been extremely emotional, extremely emotional.
Lisa, you mentioned that you've got a some 30% vacancy rate. Are you allowed to fill those beds at this point?
We are not allowed to accept known COVID positive cases. We had to apply to the state to keep our residents who may end up being COVID positive, but we chose not to pursue bringing in known positives to the building. That's a huge issue for us in trying to keep residents safe. But yes, we are able to take in admissions. Our challenge right now is we have our building is divided into 5 neighborhoods. We have one neighborhood that's entirely vacated because I don't have the staff to take care of them safely. So right now, my admission pattern is entirely based on my staffing pattern. And without more nurses, without more nurse aides, I can't take more residents and support the community. So if you know any nurses who are looking for a career change, send them my way.
Thank you, Lisa. Yeah, it's, you bring up a good point that how it's all connected, and every little thing we do matters for the entirety. So thank you for what you do. And, just to hear all the changes, to have more than, you're changing things more than once a day, that is, thank you.
Well, thanks for having me. It's great to see familiar faces. Again, being in the Noon Rotary Club for so many years, was with Paul Machel and Kathy. It's great to see you. Hugs. And I appreciate spending the morning with you.
Thank you. Thank you. You're welcome to come back anytime.
Thank you.
All right, with that, we have the quote of the day, and then we'll wrap it up. So again, the plan for now is we will see each other, if you choose, next week in person, but be on the lookout for the email from Ann with definite instructions. And if you do go down to the water and nobody's there, be sure to bring your phone so you can zoom in. The quote of the day comes from John D. Rockefeller. Don't be afraid to give up the good to go for the great. All right, guys. Thank you so much. Have a good week.
Thanks. Appreciate it.